Okay, so our next presentation is what we know about food insecurity and the impact it's having on consumers. And next up, we have Ayla, Ibrahimi, Jarchlo, and Sophie Watson, and they are social science research officers from the Food Standards Agency, and they're presenting data on food insecurity in Northern Ireland and the challenges facing individuals in relation to food affordability.
I'm Ayla, and I'm joined by my colleague Sophie, and we're here from the social science team at the Food Standards Agency. Oh, brilliant, we've got it up. And we're going to be talking through a couple of pieces of research that we've done this year, recently published, and talk you through kind of what we know about food insecurity and the impact that it's having on consumers. Next slide, please. So in this presentation, we're going to present our latest findings on food insecurity, drawn from our Food and U2 survey, which I'm sure some of you will be familiar with. The latest wave 4, was published just last month. And also Sophie's going to be taking you through findings from the UK public's interests, needs and concerns around food research. So I guess before I go into the findings, why is the FSA thinking about food insecurity? So I'm sure I don't have to go through all of this. Bertrand gave a great presentation, but we know that the price of food has increased substantially, and the cost of living crisis is very real, and it's increasingly in the public's attention. It will be more so kind of going into the winter. I've included a stat here around, so food and non-alcoholic beverages inflation rate increased to 12.7% in July 2022, and that was up from 9.8% in June 2022. And that's the highest monthly increase since May 2001. And so within that context, the FSA has a really important role to play in monitoring food insecurity levels and in providing really high quality data to both support our own decision making as well as decision making within the wider food system. And our new strategy, also published this year, set out a number of roles that the Food Standards Agency plays. So we're an evidence generator, we're a policy maker, we're also a watchdog, so protecting consumers' interests in relation to food. And it's not a new area for us. We've been tracking food insecurity levels since 2016. And throughout the pandemic, we updated our statistics regularly on a monthly basis. And we also synthesize our own and others' data on food insecurity as well. Next slide, please. So I'm going to take you through our findings from wave 4 of Food and U2, and then Sophie's going to take over the wider consumer interest research. Next slide, please. I'm conscious I'm too short for this, so sorry if you can't hear me. So firstly, just what is Food and U2? So Food and U2 is our flagship biannual survey with adults in England, Wales and Northern Ireland. It's an official statistic. It runs every 6 months, achieving a sample size of 4,000 households. So that's 2,000 in England, 1,000 in Wales, 1,000 in Northern Ireland, and up to 2 adults per household can take part. The survey measures people's self-reported knowledge, their attitudes, and their behaviours relating to food, and covers a range of topics, pretty much everything you could think of relating to food, from hypersensitivities to food safety, trust in the food system, and of course, food security. The findings are used to inform policy decision-making, as well as identify where further research or further action might be needed. So specifically in this presentation, I'm going to look at wave 4 data, and field work for that took place between October 2021 and January 2022. Next slide, please. So I won't dwell too much on this in terms of what is food security. I've included a quote up there from the World Food Summit. But I think the most important thing to mention is that Food and U2 uses the 10-item USDA food security module, which allows us to kind of group people into food secure. So individuals with high or marginal food security, and food insecure, those with low or very low food security. And I've included some figures as well. So these are kind of the questions that make up the measure. And as you can see, 1 in 4 said that they worried whether that 1 in 4 worried whether their household's food would run out before they got money to buy more. 1 in 6 worried that the food they bought just didn't last and they didn't have money to get more. More than 1 in 5 couldn't afford to eat balanced meals in the last 12 months. And just to remind you, this is between October 2021 and January 2022. And of those who had those experiences, we asked them some further questions, and 1 in 4 said that they often cut the size of a meal or skipped meals. 30% ate less than they felt they should. 20% said they'd been hungry, and 14% said they'd lost weight. And again, of those who had those experiences, we asked a further question, and over a quarter said that they did not eat for a whole day in the previous 12-month period. So this is these are the questions that make up the overall food security figure. So in terms of, oh, sorry, next slide, please. In terms of food security levels, so around 8 in 10 respondents are food secure in Northern Ireland. So that's 82%, combining high and marginal food security. And that's comparable with figures in England and in Wales. And approximately 1 in 6 respondents are food insecure, so low or very low food security. And again, that's consistent with what we see in England and in Wales. And you can see the full breakdown on the chart there, the high in the dark green, marginal, low, and very low food security. Next slide, please. And food insecurity disproportionately affects certain groups of people. And Bertrand, we had some similarities in the groups that we identified. So the following groups are significantly more likely, based on our data, to be food insecure. So younger respondents, 31% of respondents aged between 25 and 34 were classified as food insecure, compared to 8% of those aged 75 plus. Households with children as well. So 28% of respondents living with children under 16 versus 13% of those without children under 16 were food insecure. 39% of respondents in the lowest income group, so earning below £19,000 a year, were food insecure versus 9% of those earning between 32,000 and around 64,000. So a quarter of respondents with a long-term health condition were classified as food insecure, compared to 14% of those without a long-term health condition. And a quarter of respondents living in the most deprived areas, as measured by the Northern Ireland multiple deprivation measure, were food insecure, compared to 10% of those living in the least deprived areas. Next slide, please. As part of the food security module in Food and You 2, we also capture food bank use. And in the previous 12 months, 4% of respondents in Northern Ireland said that they'd used a food bank. And again, this is consistent with England and Wales figures. Next slide, please. And I just wanted to touch briefly on the relationship between food insecurity and riskier food behaviours. So we do see risky food behaviours reported more by those who are food insecure. So for example, respondents who are very food insecure are more likely to report that they are occasionally, or at least occasionally, wash raw poultry, compared to those who are very food secure. So 53% versus 35%. And then respondents who are very food insecure are also more likely to report buying and eating food after its use-by date, compared to those who are very food secure. And finally, respondents who are very food insecure are less likely to know the recommended temperature that their fridge should be set at compared to those who are very food secure. So there's a knock-on effect in terms of riskier food safety behaviours. So, you know, some of these behaviours may be influenced by directly by food security. So, for example, buying and eating food close to its use-by date, but others not so much. So in terms of, you know, washing raw poultry, there may be other underlying factors like the demographic makeup of people who are more likely to be food insecure that's driving that. But I think, next slide, please. So that's the end of my bit. I'm going to pass over to Sophie. Thank you very much.
Hi everyone, I'm Sophie and I'm also from the Food Standards Agency. I work with Ayla in the social science team, and I'm going to be presenting some research that we did at the end of 2021 and start of 2022 around what consumer interests, needs, concerns and priorities are in relation to food, as well as looking at how these vary among different groups and who's most affected by challenges in the food system. We also wanted to explore, as part of this research, what the expectations and the priorities are for government and also for food industry to ensure that these are represented and heard and protected. So next slide, please. Thank you. So just a brief overview of the methodology. So we commissioned this research out with some research partners of ours, and they kind of led on the field work, but we were very much involved throughout the whole process. The main part of the research was qualitative workshops with the UK general public, as well as one-to-one depth interviews with targeted groups. So these are people who are typically less heard by policymakers, which included people struggling with food insecurity, as well as others such as older adults, people who are less digitally confident, ethnic minority groups, and some other groups that I can't remember now. But as well as the qualitative research, we also conducted a quantitative online survey with over 6,000 UK consumers. And as part of this, we boosted the sample for Northern Ireland so that we could have some more in-depth analysis among consumers in Northern Ireland, as well as in Wales and Scotland, which already had a larger sample size. So the data that I'm going to be presenting today is all based on Northern Ireland data, but just for comparative purposes, I've also included some UK figures, just so that you can kind of see where some of the issues are playing out more strongly in Northern Ireland. But just to flag that this UK national average obviously includes Northern Ireland, so it's England, Wales, Northern Ireland and Scotland, but most of the data points that you'll see here will be Northern Ireland. If we could go to the next slide, please. Thank you. So before we look at food insecurity and the impact that it's having on people, just wanted to highlight some of the contextual drivers that really shaped consumer views in this research. So the timing of the research was quite a challenging time for people. They were really feeling the pressure. People were feeling quite unsupported, feeling that they had a sense of instability due to a lot of things that were going on. I will mention a few of these now, but there's kind of too much to go through on the slide in the time that we have. But in terms of that bigger picture context, people were struggling still with the impacts of the COVID-19 pandemic, as well as the impacts of Brexit, ongoing climate change issues, and a kind of uneven trust in government and in food industry. And then at a kind of more personal contextual level, this is the decision-making landscape that people are making food choices in. So a lot of people were really feeling quite insecure in terms of their financial pressures, food insecurity, people struggling after the COVID-19 pandemic, feeling kind of information overload, people struggling with mental health pressures. So quite a lot of personal issues playing out as well. And then finally, the timings of the field work itself. So this is when we collected the data, was between November 21 and January 2022. So during this kind of specific time period, people were struggling with COVID-19 restrictions, fuel shortages, rising energy prices, sort of government scandals in the news and all sorts of other things going on that led people to really feel quite worried about the future, not feeling very supported and feeling quite stressed after a period of prolonged pressure. So just kind of to keep that contextual information in mind. If we could go to next slide, please. Thank you. So as I said, people felt very pressured and unsupported in relation to their food choices, but this sense of pressure was higher for people in Northern Ireland, in particularly when it came to price pressures, where people were feeling more exposed to changes brought about. And there's some quotes that I've included in the presentation here. These are all from people in the qualitative research from Northern Ireland. So this person here is talking about how Northern Ireland has lower wages than in England, but the food prices are the same. In terms of a food safety perspective, so obviously as the FSA, this was one of the things that we were exploring in this research. We saw that trust in safety and hygiene standards was very high, so that was really positive. But there was a lack of trust from people in terms of in the key food decision makers. So nearly 8 in 10 people in Northern Ireland felt that the food industry was prioritising profit over people's needs. And this was something that was felt across the whole of the UK, but I'm just highlighting the Northern Ireland figures for today. And also 64% of people expressed concern for the future over the power of big food manufacturers and retailers. So I've included a quote here where somebody's talking about the food industry and how people are going to find ways to cut corners to make more profit, and somewhere in that risk is going to be introduced. Next slide, please. Thank you. So this was also just another thing to highlight that came out of the research. It was very clear that people were finding it very hard to juggle competing factors when it came to making food choices. So people were trying to juggle not just price, but also the quality of the food they wanted to buy, how convenient it was to buy that food, health and nutrition, cultural values, taste, diet, and many more factors. But actually, when we asked people what their ideal scenario would be when it came to making food choices, people wished that price and quality were kind of equal drivers, followed then by health and nutrition and food safety. But in reality, price was often the priority and would surpass all other factors due to people struggling with financial pressures. And this led to people making compromises or sacrifices in terms of their food choices around some of these other ideals, where price really was that priority factor for people. But also in terms of more basic factors such as food safety and hygiene, which is really a hygiene factor. It's what people expect and what people want. But as we'll see a little bit later, and as Ayla mentioned, food safety is a bit of a concern for people who are struggling more financially. So there were a couple of quotes here as well from people in the research. So this first quote from someone in Northern Ireland talking about how money isn't going as far anymore in terms of everything increasing. They say it's easier to mitigate against some other increasing price rises, but with food, it's a basic necessity for survival, and there's only so much that you can do. The second quote here is from someone which I think really demonstrates that kind of juggle between trying to make food choices, but they're saying all they want to be able to do is feed themselves and their family fresh, healthy, nourishing food that's sustainably produced, but they'd need a significant salary to do this, so they're a bit more limited in terms of their options when it comes to food choices. Next slide, please. So although this research was conducted with UK consumers overall, the story was very, very similar across the UK and in Northern Ireland, but it seemed to be a bit more of an issue in Northern Ireland, and I'll talk about some of the figures in a moment. But food security really was under threat, particularly among more marginalised groups. So this statistic at the very top here in the green box, this was 74% of people in Northern Ireland reported that they'd modified their food behaviours in some way due to financial concerns. And this was notably higher than the UK average figure, which was at 65%. And we also captured some different food-related behaviours, and 31% of people reported behaviours which were associated with being food insecure. So as Ayla mentioned earlier, the USDA have a measure which captures different behaviours and kind of groups people into different levels of food insecurity. And we used a similar approach here. And we saw that 31% were reporting some of these behaviours, such as being unable to buy food, being unable to afford healthy or balanced meals, eating less or skipping meals, not eating when hungry, or using food banks. And all of these behaviours were much more prevalent among those on lower incomes as well. We also in this research, though, captured some other peripheral behaviours or sort of softer food insecurity behaviours. So these are things that aren't typically captured in the USDA measure that's used in Food and New, for example. But they kind of demonstrate a bit of a tipping point between those who are more food secure and those who are food insecure. And these are behaviours, again, related to financial pressures, but could kind of shift people, I guess, even in sort of higher income groups into more food insecure groups. So some of these behaviours that we captured in the survey, for example, on this slide, in Northern Ireland, we have 36% of people saying that they'd swapped branded products for cheaper alternatives to fit their budget. 21% had reduced the quantity of fresh produce and fresh foods to save money. And 20% had also bulked out meals with cheaper ingredients to reduce costs. And again, we wanted to look at some of the sort of food safety and food hygiene related behaviours and kind of look at that from an FSA angle. And we saw that people who were more food insecure and those who were on lower incomes often had higher concerns when it came to food safety and hygiene. And they kind of felt more exposed to risk or were adopting riskier practices as well. So some of these I'll mention in a moment, and Ayla mentioned some in her presentation. But people talked about making risky or adopting risky practices to make money stretch. So for example, eating or freezing about to expire food, batch cooking, and then eating those leftovers throughout the week and sort of reheating those meals so that they could have several meals throughout the week, but also buying lower quality foods. Now, lower quality in this research, when we kind of explored this qualitatively, was associated with foods being cheaper, being more processed, being higher in saturated fats, sugar and salt, being less healthy, less nutritious, and less fresh, and that kind of thing. So these people who were suffering from food insecurity really felt they were quite restricted in terms of those kinds of food choices. So there's a quote here from someone talking about, when did it happen that buying good local food became something that only wealthy people could afford? Why is it that in our system it's only the ultra processed stuff in boxes that you can afford and the only stuff that's ever on sale? Next slide, please. So it was very clear in this research that issues around food prices, affordability, and social inequalities dominated. And as I mentioned, this wasn't just among people who are food insecure, but also people who are kind of starting to struggle. And I imagine being pushed more into that now that we're further on into the cost of living crisis. In the quantitative online survey, we asked an open-ended question to people, so to try and capture their spontaneous responses. And we asked them what they were concerned about when it came to the future of food over the next few years. So 22% of people in Northern Ireland spontaneously mentioned food prices as a future concern, and this was far higher than any other mention that we captured and coded in the data. But this was much higher at a prompted level. So when we showed people a list of various food-related issues, 80% of people in Northern Ireland selected food prices as a future concern, and this was the highest issue area. Also, 73% selected the cost of healthy food as a future concern. And only 48% of people said that they were able to afford the quality of food that they want at all times. And when we looked at this among some of the different groups and some of the different demographic groups, this dropped to only 30% among those on lower incomes and was also much lower among those who were food insecure. So another quote here with someone talking about the price of food and how their wages are not increasing as quickly as the price. They feel that the same variety is not available to them and the availability of things in the future hangs in the balance. So looking forward a little bit, we wanted to understand what people wanted food industry and government to do and what that kind of top priority action area would be. And really the overarching priority that came out in this research was that people wanted to ensure there was equitable, affordable access to safe and healthy food. So as part of that future concerns question, we found that 67% of people selected food poverty and inequality as a concern. And actually, when we asked people what the top priority action areas were for food industry and separately for government, the top priority for both of those separately was around ensuring healthy food at affordable prices. Next slide, please. So finally, just wanted to highlight some of the other bits. We explored a wide range of topics in this research. I've mainly focused on sort of food affordability, but we also captured data around health and nutrition and the environment and ethical animal welfare issues. But just wanted to highlight in this presentation that people found it really, really challenging to make healthy and nutritious food choices in terms of budget. So this was significantly more of a challenge for people in Northern Ireland when we compared this with that UK overall average, or in some cases, the other nations. So 60% of people in our quantitative survey said that they felt priced out of healthy food, and this compares to 53% in that UK average figure. 38% of people said that they found it difficult to find fresh foods that fit their budget. And 32% said that heavily processed foods were often the only option available to them. And it's also worth highlighting here that these behaviours or attitudes were also significantly higher among those who were food insecure compared with those who were food secure. And the other kind of key point that I wanted to make on this slide was that people not only found it challenging to make healthy choices in terms of budget, but in terms of the food landscape. So just over half of people in Northern Ireland said they thought that supermarkets encouraged them to buy unhealthy food. And many people felt unsupported or at worst actively misled by food industry in terms of making healthy food choices. And there were some concerns expressed by people, particularly in the qualitative research, around more marginalized groups being more targeted by unhealthy food or fast food and convenience brands that then may impact health and worsen health outcomes in the long term. So one final quote here from someone, I wish healthier options were the cheaper option instead of the unhealthy stuff. It's cheaper for me to buy a frozen pizza and a bag of frozen chips than some fruit. Also, where they're displayed in shops, the sweets and chocolate are always placed at tills just as you go in, so that's the first and last thing that kids see in shops. So I just wanted to kind of bring in that element that the research that I've talked about here today captures lots of different other issues in relation to food security, or those who are kind of in those lower income brackets and more likely to be suffering from food insecurity. Next slide, please. I think it's the final slide. Yeah, so just thank you for listening today. If you're interested in the research that Ayla or I have presented, both are published on the FSA website. The data tables are also publicly available, so you can download and have a look at the data. And if you'd like to get in touch, I think our contact details are on the next slide, but hopefully these will be shared more widely afterwards. So thank you for listening.